Quality is kind of what we're all about, I think, in healthcare. You go into the healthcare system to either remain healthy or get healthy. And the ability to achieve that end is reflected in quality. I think one of the best definitions of quality I've heard from the Institute of Medicine was what they referred to as the triple aim. It's patient-centered healthcare outcomes, patient satisfaction in terms of both quality and the patient experience. It is improving the health of populations, not just the individual patient, but the population you serve. And it's doing so in a cost-effective manner, giving value, which is obviously important in this era of finite resources. Where quality really counts is within your local healthcare system. And that's something that I think we've been committed to for many, many years. There's sort of three elements, I think, to creating a quality environment. Part of it's structural. You have to commit to having the resources you need to take care of people in an effective manner. So you've got to have adequate facilities. You've got to have clean facilities. You've got to have adequate nurses to provide care. You've got to have the laboratory support and all the infrastructure and all the people it takes to provide that care. You've got to ensure that your physicians and your advanced practice clinicians are appropriately licensed, credentialed, board certified, that they're maintaining a higher than minimum standard for continuing medical education. That's kind of the structural infrastructure that you have to have in place. Beyond that structure is actually executing the process of care. So that means, are you giving the right care? When people come in with heart failure in my world, are you given what we call guideline-directed therapy, the things that we know based on the best science available are going to not just make patients well for the moment, but are going to make them better in the long term? If you're taking care of the heart attack patient, are you giving timely care? Do you get that patient in quickly? Because we all know, and we all hear this time and time again, the phrase time is muscle. That means we've got to have processes of care that ensure that patient goes from the 911 call and the EMS transfer or walking in the emergency room into the cath lab to get that artery opened in the most efficient manner possible. We've got the environment of care. We've got the resources for providing care. We've got our processes in place that we think help us provide good care. Are those translating into better outcomes? Are people living better? Do they leave the hospital healthy? Do they stay healthy, stay out of the hospital? Do you provide adequate transitions of care from the hospital to the ambulatory environment to home so that they have the resources they need, whether it's home health care or counseling, medical follow-up, et cetera? That cultural quality first has to start with an organizational commitment. You have to say, this is our highest priority. This is a greater priority than margin or profitability. It's a greater priority than just growth or economics of expansion in there. It's really what we're about at the very core of our being. So you've got to have that commitment organizationally. It starts with the board. It starts with the CEO. It's embedded in the mission statement and the vision and the strategies of the organization.